Malacanang confirms that President Duterte wants face shields to be worn only in hospitals.
Ang IATF is recommendatory to the President. No? And when the President has decided, then that's the policy. This is without prejudice to IATF appealing, possibly. No? Alam nyo kasi, ang posisyon naman ng DOH, may mga pagkakataon talaga na dapat isuot pa yung face shield. No? At ito po yung lalong-lalo na kapag nasa indoors na maraming tao.
Doon po sa joint memo circular namin, may mga exemptions tayo na-identify. Balikan po natin ang objective ng face shield. No? This prevents yung droplet na mag-land sa face mo. So kung wala naman kung maraming masyadong tao, like you're outside also, you don't need to wear that face shield.
Sa pang-publiko, I think required pa rin yung face shield. Pero yung outdoors, naglalakad lang. It was my understanding din, hindi naman siya required kasi marami akong nakikita outdoors na walang face shield eh.
Government is hoping for a Christmas without face masks, but the IATF maintains that for now, the protocols, including the use of face shields, will remain. But will the government be able to fully vaccinate its target population in time? We discuss in this episode of The Chiefs. Welcome to this Thursday edition of The Chiefs. I'm Edwin Gao, and also with us are Ana Marie Pamintuan of the Philippine Star and Lucy Cruz Valdez, the head of News 5. Ladies, happy Thursday.
Hello, good evening.
Oo, isang araw na lang at matatapos ang kalituhan natin.
Akala ko ba, nako talaga?
Actually, hindi. It will be in suspended animation lamang.
Ay,
Aling kalituhan ba ito pinag-uusapan natin? I suppose we're talking about the same thing. The policy or non-policy or uncertain policy on face shields. I know it does sound a bit, it might sound a bit frivolous to some people when we talk about whether or not you should be wearing face shields, what the policy is. But you know, in the end, people have to wear face shields because they believe it is required by the government. So there remains a question, should they be wearing face shields, whether indoors or outdoors, and so on down the line? Nalinawan ba kayo today?
Kailangan yung rule, di ba? Because you might get apprehended.
That's it.
Diba?
That's it.
Hindi malinaw yung policy eh. You could end up in a detention.
Oh.
Kung may violation ka, yan ang problema dyan.
Di ba? Nakakahiya naman yun, di ba? Biro mo, Ana Marie Pamintuan, tiklo.
Magpapakuha
Sa hindi pagsuot ng face shield.
well, dapat exclusive kami ha.
Papakuha rin ako ng
Di ba? So we were hoping for some clarity today through the presidential spokesman Harry Roque, and he did attempt some clarity, but ayun nga I'm not really sure if it's any clearer now.
But it seems he failed.
As of this evening,
Because we're still talking about it.
Okay. But anyway, let's bring in our first guest tonight. Well, of course, our favorite guest for the Chiefs. We will talk about a lot of things. Among them, the numbers, not only in NCR Plus, but also throughout the country. But also for that, I'd also like to throw in the question of the face shields to our guests. Our guests, of course, are fellows of the OCTA Research Group, Professor Guido David and Professor Ranjit Rai. Gentlemen, thank you for joining us and welcome back to the Chiefs. We haven't seen Professor Rai in a while.
Yes.
Yeah, I know. How are you, Professor Rai?
How are you guys?
Yeah, you have a different glow tonight.
Yeah, that's because the lighting here is really bad. That's why I have a good glow.
Okay, it's the lighting.
Good evening to everyone. I miss you guys. But I think Father Nick and Guido have always been here, so we share the same views anyway. So thank you for inviting us.
Yes, sir. Well, sir,
Good evening.
Good evening, sir. Like I said, we want to go into the numbers regarding COVID-19 and all that. But before we go into that, let me ask you first about this, the issue of face shields. Now, you've been monitoring the numbers since for more than a year already. And of course, you have been looking at patterns and all. And now comes the question, should we still continue wearing face shields at this point? Not just whether it's indoors or outdoors, but at all. That was an issue that was raised by the President last night when he met with the senators. Ang sabi ng Pangulo kagabi, according to Senator Soto, pang-hospital na lang yan. do we have, do you fellows, fellows in both senses of the word, do you fellows have any opinion regarding the face shield matter?
Maybe I'll start to put some perspective to it. When we first were invited to Malacanang, that was I think July 15, 2020. It was discussed in that cabinet meeting, the importance of adding layers of protection. And indeed, there is science to prove that the face shields do add a layer of protection combined with the face mask. No? And the protection can go up to 8 or 10% addition. Now, during that time and until this time, we believe that the face shields have been useful. They have been extremely inconvenient. But COVID is inconvenient. You don't change epidemic management because of convenience.
Yeah, certainly.
We just came out of a very painful, terrible surge. And I think to a great extent, much of the damage was minimized because of these layers of protection. Now, my sense is this, we're always open to adjustments, to policy, and to adopting best practices. But when we make decisions, it has to be based on science. There has to be some sort of study first about the efficacy of face shields. I believe, given the real threat of these game-changing variants, most specifically the Delta variant, the Indian variant, yeah, and the reality that there are surges, because of density and mobility, and the fact that our vaccine program is delayed, that places like Metro Manila, Metro Davao, Metro Cebu will always be vulnerable to surges. And any additional layer of protection will always be helpful. And this is where I'm coming from. Now, as to the frequency of it being used, as to where it can be used, maybe we can make adjustments there. But I feel that it's important to keep the face shields for now, until we have proven scientifically they're meaningless and useless. And only when we have the data, when we have the science, do we change policy. Our basic fear in OCTA is that epidemic management is seemingly being transformed, as elections come near, and we don't like that. We disagree with the idea of politicizing epidemic management.
Okay.
It has to always be guided by science, and we have the best scientists in DOH. Most of them are also from UP, by the way, and colleagues of ours, and they have enough data to say that in a sense, the face shield and face mask combination has saved the day for many Filipinos. In many countries where there was only face mask, we had huge numbers of people dying. Okay, we have to account for all of these things. It's inconvenient, but so is COVID. Now the key thing, and by the way, this is a big issue. It's not just the face mask. It's local governments, asking for a loosening of our border restrictions. It's a whole gamut of issues, where non-scientists have come in and are now shaping policy. Now, all we want in OCTA is let's have a good, honest conversation about face shields and border controls, but it should be guided by reason. It should be guided by science always. And at this time, majority of us still support the government position, whether it's on face shields and whether it's on border controls. And that's we want to state that. But is there division in OCTA? Is there discussion, not division, but discussion in OCTA about alternative? Yes, there's a very robust discussion on face shields. There are some fellows don't believe that it's either convenient or actually effective. But we don't have data to say otherwise
Yes,
about
sir.
the effectiveness. So until there's a study, why
Yes,
do we
sir.
change things when it ain't broke in a sense, Why fix it when it ain't broke and when it's actually doing good?
Yes, sir.
So this
Certainly,
is
sir.
the issue.
Yes, sir. Sir, but I was just talking to Secretary Duque just a few minutes ago and asked him this question: what exactly is the policy on face shields at this particular point in time? And he was quite clear in saying, now what the President said last night in his meeting with the senators na ang face shields pang-ospital lang, that is policy for now until or unless he acts on the appeal or recommendation of the IATF to reinstitute the old policy na requiring face shields.
And I agree, guys. I agree. No, when the president says it, it is policy, and I agree with that. But if the president says it and without the advice of his best scientists, no, and only in discussion with people who might not be the best experts in
The
that field.
senators.
Yeah, I love the senators, no, and I know Senator Tito means well, and there's a public clamor to restudy face shields. All I'm saying is that as we continue to evolve and improve our practices, no, and policies, that they be discussed and deliberated with the help and assistance of scientists. We know the discussion happened a few nights ago, and it has come out, no, unofficially as from our leaders, no, from in the legislature. What we feel is maybe this wasn't the best way to do it. Maybe it would have been good if it went to the IATF. Even if they wanted to change the policy, it should have gone to the process of being vetted, and then the decision would have been made. But we respect the president's position on this issue. It's just that we feel that if we want to narrow arbitrariness, we want to be calculable and predictable, we want to be science and database. That's all that OCTA wants. Now, and this issue about loosening border controls is a very, very passionate debate within OCTA. Some fellows have decided not to go with the majority on this, but really the government is right, has hit the head. It's on track and correct in its position as far as border controls are concerned. And I think it will be catastrophic, no, if we adopt a loosening of border controls at this time, when we know for a fact in many countries the Delta variant is ravaging and creating massive surges. In the UK, where a significant number of the population is already vaccinated, we're seeing a massive surge in cases, largely because of the effect of this new variant trying to replace
Delta. Yes.
the Delta variant.
So ito bang so Professor Rai, ito bang increase in the number of cases in Dumaguete, in Negros Oriental, in Mindanao, particularly Davao, no, and Agusan, do you attribute that to the loosened border controls? Anybody? We'd like to welcome also si Father Nick Austriaco. He's here with us now. I don't know if...
can we also bring Father Nick in?
Yes, yeah. So
we can also ask him later about the yeast vaccine.
Yes,
but mamaya.
So my question, do you attribute it to the variant now directly and to the loosened border control? Professor Guido.
Prof, I think you're muted.
Mute.
Yeah, sorry, I will answer that first and then maybe Father Nick can add to that. We don't know yet, as far as what we know right now, the Delta variant is not yet in community transmission in the country. This is to the best of our knowledge. Now, that may change if we get information on genome sequencing, because we know that in the provinces, the genome sequencing can take a while before we get the information. But as far as what we know, and based also on the numbers that we're seeing, the rate of increases, we actually believe that it's not yet in community transmission. But we don't want the Delta variant for sure to come into community transmission. Now, when we are talking about the reason for the surges, there are actually, we can attribute part of it to lax border controls, of course, because how will cases move to the remote provinces if our borders are very secure? So, but whether it's the local borders or international borders, that will have to be discussed at some point. But definitely there's an issue with border controls. And this is what happened. And Father will also echo me on what I'm going to say, that the surges are driven really by the variants. And this is what we have seen in the history. And what we fear right now is if the Delta variant comes into community transmission, we know it's already entered the country, but not in community transmission. But if it enters community transmission in one of these provinces, in maybe, for example, Metro Cebu, in NCR, then we will have another surge. I mean, that's all but guaranteed. The numbers right now in other countries show that the Delta variant is 60% more transmissible than even the UK variant, which is already 50% more transmissible than the first version of the virus. So this is already going to cause a significant surge in the country if it happens.
I want to go back to the face shield issue because the IATF also made the recommendation amending the rules a bit. In your opinion, is there room for compromise here? Like, what should be non-negotiable? Wearing of face shields on mass transportation, for example, in those waiting lines at the edge of busway, for example. Is there room here for compromise?
So let me take that. The science shows that the face shield adds about 10% more protection against COVID transmission. And when I was asked that question earlier today, I pointed out that this is a risk-benefit balance, right? So you can imagine, for example, if a region of the Philippines is in ECQ and the risk of getting COVID is substantially higher than that in MGCQ, we may associate face shields with higher lockdown quarantine requirements. So if you are in ECQ and it's very hot, then every protection is good. If you're in MGCQ and you're outside running, and the risk of getting COVID is very slim, then you are willing to lower your protection by 10%. So, but I asked the government to make it simple and consistent, because right now there is so much confusion. Even my mother today had no idea what she was supposed to do when she went outside to water the plants. So
Father,
my
come
mother
in. Father, come
follows
in.
the rules, and she would put her face, when she goes outside, she puts her mask, she puts her face shield just to go to the garden to water her plants. And today she was asking me because she heard on the news that the president had talked about. So she said, do I have to wear my face shield to go outside to the garden? Now, I pointed out to her that she has not left our house in 15 months and there is no one in the garden. So technically she can remove the face shield, but my mother will follow whatever the rule is. And I think there's much confusion. So whatever the rule is, it has to be incredibly consistent, right? And the danger now is that no one knows what to do, so no one does anything.
That is a danger. When you have a point of confusion and nobody is certain which rule is to be followed.
Yeah. Well, then they will just not follow it.
Professor Rice, the room for compromise, do you think? Like, for example, you limit to workplaces or to the MRT or jeepneys, the wearing of face shields?
Yeah, I think there's always room for compromise. It's just that these pronouncements have to go to the regular channels. We have a system now, it's the IATF, and it's been doing a credible job in terms of managing the pandemic. So what I'm suggesting as a governance scholar is that this has to be done in a systematic way and should be harmonized with science and data. Number two, we have to give time for the information to cascade down officially and for local governments to recalibrate their ordinances. Remember, IATF only provides the policy guidelines.
Yes.
It's the local governments
It's the LGU.
of this country that will implement them, and they implement them largely through ordinances. And many of these local governments have already made ordinances for face shield and face mask. Some enforce them with penalties and sanctions. Others just simply monitor and enforce without any sanction. So we need to calibrate all of these things. And now, because of what happened, the decision may be about face shields, mandatory or not, maybe an open debate. But the way it came out in the media, from one government undersecretary first, then from a member of the legislature, it creates confusion, and this is not the kind of governance we need at the moment, especially now when we're trying to just, exit out of a surge and trying to sustain the gains whilst we're waiting for a big surge in vaccinations. This is not the kind of things that we want, no? The messaging.
How do you?
We disagree with the messaging.
Right. I agree with you, but how do you expect the president to walk back on it now? And how soon? I mean, if that's even gonna happen. Kasi, di ba, parang it's already precisely, let's just call it awkward because that's what it is. I mean, so the president finally, when we had all but settled in the position that, face shields are required, okay? Then all of a sudden the president says, you know what, face shields, you don't have to wear them except when you're in the hospital. And now today, wala pa 24 hours, sinasabi na i-appeal. But do you really, I mean, in terms of governance, Professor Wright, you think it's a good idea for the president to walk back on his statement just less than 24 hours, or let's just say even by tomorrow? Ganon? Di ba nakakalito
As
rin?
always, to be fair to the president, no, he was also advised, and he was given advice by the people around him at that time. Now, with the benefit of an appeal from the IATF, maybe we can calibrate this. We can gradually, improve, how we're going to use face shields, and maybe together with local governments, we can make it less mandatory. We can specify where they have to be utilized. Maybe for me, critical sa akin is public utility vehicles. We need to have face shields there. It will become, the PUVs will become vectors, facilitators of, viral spread in this country, especially in the National Capital Region, without those face shields. So, this is the key thing. If we're going to take the face shields out, we're going to have to minimize the number of people inside vehicles, reduce the number, increase the spacing. The face shield, remember, was the compromise for increasing the number of people inside vehicles. Again, we need time. My own problem is not the president, deciding this or that. That's his right as president. But the thing is, it should have come out in not the way it came out. No, it created confusion. It should have come out in a new IATF guideline or ruling, and even the IATF was caught off guard, and that's why there is an attempt to appeal. And I believe the president, given the preponderance of science and data, will make adjustments in his own initial position.
In the meantime, OCTA is also tracking the flare-ups outside Metro Manila. Is there any new particular hotspot? Because we're noticing an alarming increase in the Bicol region, for example. What's happening there?
Well, I'll take that. Well, in Bicol, it's an alarming increase. Well, I wouldn't say it's alarming because the level it is at is, I wouldn't say it's alarming, but it's alarming considering the history of the region in that it hasn't seen this kind of increase over the past year. But relatively, it's still not as as high as what we're seeing in other areas. And just today, someone pointed out that yesterday's Davao City recorded 397 new cases. So that's also concerning. So there are other regions that are having significant increases, like in Dumaguete. So it's all over the country. It's happening not just in a specific region. It's also happening in Tacloban, in many parts of Mindanao, and in Western Visayas, as we mentioned. So Bicol's actually, compared to the others, I would say that it's relatively okay. But I think they're having problems with their hospitals and their ICUs, and I think that's the cause for the alarm. But not so much because of the actual numbers themselves.
Mm-hmm. I will be remiss in my duties if I do not ask Father Nick about. I think you know where I'm going, Father Nick.
Hello, Ed. Yes, Ed. So I have assembled a team of 7 scientists at UST, and we have to write the protocols to request permission from the IOCOOC, which is the Animal Ethics Board, in order to purchase our mice. So that is the next thing. So we have the group now, we have the lab, and the next step now is to try to get these mice from Taiwan. And one of the things I'm discovering is that bringing things into the Philippines is a lot more complicated than I'm used to.
Oh, yes, Father. That is,
Bakit kailangan galing sa Taiwan yan, Father Nick? Ba't kailangan
Because there's
mice?
the company that provides these Balbsi mice is headquartered in Taiwan, in Taipei.
Wala tayo dito.
So we do not have this particular mouse. I cannot just go outside and get Filipino mice.
sa
I need to get
Carriedo, di ba?
What is it that the Philippine mice cannot do that the Taiwanese mice can?
It's actually not a Taiwanese mice, it's an American mouse.
Oh, wow. White supremacy to.
Okay.
It is
Well,
a
Father,
white mouse.
we spoke to the DOST, I think a week ago, and they said that they would welcome any moves by any Philippine group to develop its own vaccine. They're just waiting for word from, for example, your group.
Yes, so we were, again, I'm just learned, I was trained in the US, I'd run a laboratory in the US, so I have to learn how the Philippine science system works. And it's not quite what I am used to.
Okay.
Oh,
Father,
that's a topic for another time.
Father, one last na lang. You're a molecular biologist. There was a report today from Indonesia that more than 350 doctors were infected with the Delta, I think the Delta variant, after they had received the full dose of Sinovac. Now, how worried should we be considering that we are getting millions of Sinovac doses in the Philippines?
So you can ask, that question has to be relativized. First of all, you must understand that doctors are exposed to higher numbers of patients and higher amounts of virus than a typical Filipino citizen. So that's the very first thing. Those numbers have to be put into context of how many doctors there are. And I've heard there was something like 5,000 doctors in that area. So it's 300 out of 500 got COVID, and then only a few of them are actually in the hospital. So we have to keep the relative numbers in mind. We are still waiting for it's called the effectivity. So we know the efficacy, but we need the effectiveness of Sinovac, and Sinovac has not yet released that information. Again, any protection is better than no protection, and so we have to simply move forward, and we will see what will happen as we try to achieve containment and herd immunity in the NCR +8.
Okay. Well, gentlemen, we certainly are honored to have all three of you here with us tonight. Full force kayong tatlo ngayon.
Yeah.
And welcome back to Professor Ranji Trai.
Yeah. Thank you for inviting us.
Thank you.
Thank you,
Yeah,
sirs.
thank you.
Professor Ranji Trai, Professor Guido David, and Father Nick AUSTRIACO of OCTA Research. Gentlemen, thank you very much for joining us again tonight.
Thank you.
Thank you. Thank you.
Ingat po.
Thank you, everyone.
We will just go into a break, so please stay with us. Welcome back to the Chiefs here on One News, and now joining us is Health Undersecretary and DOH spokesperson Maria Rosario Vergeire. Yusek Vergeire, thank you for joining us and welcome back po to the Chiefs.
Good evening po.
Evening,
Magandang gabi po. Good evening.
Yes po. Ma'am, sorry po, I do have to say po that I think a lot of people are confused with regard to the policy on face shields kasi magmula nung kagabi na nag-tweet si Senator Soto quoting the President hanggang kanina, medyo nagugulan po yung marami kung kailangan ba sila magsuot ng face shield o hindi. Pero po, to begin with po, we understand the science, we've been told again and again, is that there's at least a 10% increase in protection if you wear the face shield. But as a matter of policy, where are we now? Who do we follow?
Well, for now, the IATF this afternoon had a meeting and recommendations were made. The experts also gave their recommendations, and now it will be up to the Office of the President because the appeal was submitted. What was announced a while ago was that what would be implemented would be the status quo until the Office of the President will decide.
The status quo meaning what we had the other day, kumbaga, that face shields are necessary indoors and in some cases outdoors. Tama ho ba?
Yeah.
Yeah.
Yes po. That's
It's not the President's latest pronouncement. That's not the status quo.
It was decided in the IATF that until the Office of the President will give his decision because an appeal was submitted regarding this. So it was stated that we maintain status quo for this time being. So that would be following the joint memo circular that has been issued since January of this year.
Yes, ma'am. I think po, that's one of the points of confusion Kasi as of this afternoon, ang sabi po ni Secretary Roque, what the President said last night in his meeting with the senators is the policy already. And then when we talked to Secretary Duque kanina, sabi niya, until Malacanang acts on the appeal of the IATF, actually even Secretary Roque called it an appeal on the appeal of the IATF, last night's policy statement of the President stands. So medyo naguguluhan po kami kung ano yung susundan.
Yes, sir. Actually, kahit naman kanina yata doon sa interview with Secretary Roque, he said that it's subject, mag-aapila ang IATF.
Opo.
So that is what has been done this afternoon. It was discussed and an appeal has been submitted and it was pronounced that we will maintain status quo until the Office of the President decides.
Yusek, what's the main argument behind the IATF's appeal? Ano yung pinaka-selling point for the face shield?
Well, it's still science. And the science behind that would be that WHO already gave their statement about, for example, indoor spaces where the virus is suspended longer and it becomes airborne. That's first. The second would be that the face shields have that benefit, even though it's just minimal, but when you couple it with the other interventions like face shield and physical distancing, your protection goes up to 99%. And I think the most critical would be now that we are seeing a lot of variants and the Delta variant or the Indian variant is a threat already to our country. I guess a relaxation of our measures would not be appropriate at this time. But then again, as I've said, we wait for the decision of the Office of the President.
Okay, just for clarification, the status quo is you should wear face shields when indoors.
Yes.
Or when indoors and outdoors. What is the status quo?
Yes, ma'am. The status quo would be, according to our joint memo circular, would be in indoors like workplaces, places of worship, and the other indoor spaces, you need to wear your face shield. But for the outside or outdoors, there would be certain circumstances or settings only that you would be required. Like if you're going to ride a transport and there is crowding, especially, you need to be wearing your face shield. If you are in an open space but there is crowding, for example, you went to a Changi, you went to a park where there are a lot of people, you have to wear your face shield. There were exemptions stated in this joint memo circular. Like, for example, if you're just walking alone or you're doing active transport or you're riding a motorcycle, you're doing strenuous work, so you are exempted from using this face shield. But soon after you are done with those activities, you need to wear your face shield.
Yusek, do we have any idea where the President got his opinion last night na hindi na kailangan?
Science.
Actually, we had been receiving this kind of request for these past weeks. people were saying that no other country is implementing this kind
Yeah.
of practice. The second one
Right.
would be that it's really very hot, no, these past months, and people are getting uncomfortable. And the third would be that they were questioning what would seems to be the benefit of face shield. And we have positioned that there are evidences, and there are other countries which have used this, though voluntary for the other countries. Parts of United Kingdom, some areas or states in the United States, Malta, India, these countries have used this, no? Though not as we have done it here that it was mandated. In the other countries, it was voluntary. But using that as an example, you can see that other countries also recognizes the benefit of this kind of practice.
Yusek, what about the compliance with the other health protocols? I'm speaking specifically about Cebu province, because even the DOH office there is saying that what they're doing is correct about the testing, about their quarantine protocols. Sino ba talaga masusunod kapag ganon?
Well, it should be IATF, and the IATF has already resolved that the protocol should be uniform across all of our regional areas. Second, the Office of the President has already given its directive for the Cebu province to follow the IATF protocols. We need to have some form of uniformity in what we implement in our response, especially in the borders. It could not be that it's just Region 7 and the others would be implementing differently, because our borders are very porous. And then, with this, the identification of variants, the threat would be there, especially now that the Indian variant is spreading across the globe. We need to be very, very careful. So again, we maintain the position that IATF protocols is based on science and it should be followed by all regions.
But will the IATF protocols trump, let's say, a provincial order? Because that's what the Cebu
Opo.
mayor is saying. that
Or
there
an
is a
ordinance. Kasi
Yes.
if you ask Governor Garcia, sinasabi niya na in
Provincial
the end,
law yun
we
eh.
are following the law. And the law is what the local government unit passes.
It's the provincial government that passed that requirement.
Yes, ma'am. Yes, I think I am not the appropriate person to respond to this. No, it would be the ILG, and I am not really a legal person. What I just know of would be that there are certain protocols, and the protocols has to be complied with. There are national protocols and policies, and these are directions and strategies, and it has to be complied with by all local governments so that we can be able to have a uniform response and we can prevent more infections.
Yes, ma'am. Well, I think we understand naman po what you're trying to say. I think what we just want to find out is it appears that Cebu is digging in on its position, and it also appears that the IATF is insisting that this is policy. So you have two apparently conflicting positions. What happens next? Who gets followed, and how will it be enforced?
Well, there are these discussions and there is this invitation by the province for our experts and the IATF officials to visit their area. And that will be done. And I think everything will be managed by just discussing and meeting with them. Although we need to comply because there is this directive already from the Office of the President aside from the protocols of IATF. So I guess that is enough already as basis that they should be following this directive.
In the meantime, how are we addressing for the protocols naman for those areas or LGUs where the numbers are now rising and where there seems to be a surge? Are we going to leave it to the LGUs also to decide their quarantine status, or will they get orders from the national government on that?
Well, we already had escalated a number of these local governments, these provinces, last time that IATF decided. We do not leave to the local governments whenever we see that there is this basis for us to escalate. Even though they would be appealing, we would be disallowing or rejecting these appeals if we see that it is but right that we escalate the quarantine classification so that we can help them as well. But for those local governments which have this manageable number of cases and also their facilities are still manageable, then they can implement their granular lockdowns and they have that authority.
Kasi yung Negros Oriental, parang sinasabi nga nila, they cannot afford a lockdown, no? And they would rather stick to the granular. So when does national government step in to say, no, you're just going to have to do it?
Yes, when we have parameters that we use, it is still based on science. When we escalate when we see that your healthcare capacity cannot manage it anymore. National government has to step in. So what we saw in Negros Oriental would be that we saw that their healthcare capacity cannot manage it anymore, and we saw that their resources cannot be expanded further. So national government has to step in. The community quarantine classification has to be escalated and assistance should be there.
Yusek, speaking of healthcare capacity, there's also some confusion. Dr. Maricar Limpin of the physicians group says that the critical and severe cases in Metro Manila have gone up, and ICU occupancy is almost 100%, at least in her hospital. And she's seeing a similar pattern in just the past week in Metro Manila. But the DOH says this is not the case. So what's really the real picture in Metro Manila?
Yes, ma'am. Actually, we tried to review when we heard of this news. And we tried to look at our figures and looking at our utilization rates across the different hospitals in Metro Manila. And what we found out would be that there would be about 19 hospitals that really, when you look at the parameter, they are almost full for their ICUs. But when you look at the number of beds that they have in their hospitals, it's quite small. Some would just have 2 ICU beds, some would just have 3, the others would just have 6. So these are the smaller hospitals that we have in Metro Manila. And one of the things that seemed strange because the numbers were not equating to this full ICU. So we will be conducting further investigation. But for now, what we can say would be we understand what Dr. Limpin is saying because we know that they are the doctors and they are the ones on the ground. But having to look at the whole expanse of our hospitals in Metro Manila, we can say that we are at that safe level still. Although some of these hospitals may be full because it would be that their ICU beds are just at that minimum number.
I checked po your figures yesterday. In Metro Manila, the ICU occupancy rate was only at 48, I think. And nationwide, the ICU occupancy rate was at 52. So that's why we had a bit of confusion there kasi when we were listening to Dr. Limpin, I think earlier this week, alarmingly almost 100% raw. So it's not even close. Yung numbers are not even close.
Laki ng
Well,
discrepancy.
we have to understand also how they feel. They are the ones, in front and taking care of the patients since we started, and they're really tired. So just a little, signal of increase in the number of cases and increase in the number of beds being occupied, that really sends a signal to them, and they really want that we do something at once, and we are responding.
Hindi kaya there's a difference between ICU beds for COVID cases and ICU beds for the general cases? Maybe
There really is, yes, ma'am.
COVID.
Yes, ma'am. There really is a difference between these two. That's why we say we have COVID and non-COVID beds. And what we include in our reports would just be the COVID beds.
At
What about ma'am sa ibang lugar, no? Kasi yung critical care capacity doon, how are we, for example, in Mindanao and in Negros Oriental, di ba? Lalo na Iloilo, matagal nang nagsa-struggle yung mga hospitals doon for lack of capacity. Have we addressed that?
Yes, ma'am. Almost all of these hospitals which we have identified to be our flagged areas, we already have provided the necessary assistance. Of course, we cannot provide everything that they would be requesting, but at least we already have been able to expand ICU beds. through our offices in Visayas and Mindanao, through our undersecretary there. We also were able to provide additional manpower, additional budget, and of course, additional vaccines to this area. So all of the assistance are being provided, and hopefully we can all be able to manage this increase in the number of cases, and it just stays there and starts to reduce in the coming weeks.
Ma'am, cambio naman po ako sa... Ami, go ahead.
Sige. Dr. Limpin also told us na naninibago daw yung mga colleagues nila outside Metro Manila dito sa surge. So nahihirapan daw. And there are reports from the provinces na nahihirapan mag-deal dito sa new variants ang mga health workers outside. So are you also implementing the step down, your step down program there? Kasi ayaw daw ng mga pasyente na umalis ng the recovering patients don't want to leave the hospitals to the quarantine facilities kasi napaka-inadequate daw ng mga quarantine facilities. Ano po yung ginagawa ngayon dito?
Actually, ma'am, may report din naman sila, ang DPWH, sila Secretary Villar, that they are really fast-tracking the expansion of temporary treatment and monitoring facilities in these different areas. What they are experiencing, we have experienced here in Metro Manila when we had the increase in cases, because most of their hospitalized patients would also comprise of mild and asymptomatic patients. So ito pong ginawa natin dito sa Metro Manila, we have already instructed our regional areas that it should be that we should be transferring to step-down facilities these patients so that we can accommodate more patients. So with this scheme or this practice, it should be that we can be able to decongest more so we can manage more. About the variants, we are seeing that the variants really are playing, is a critical factor in the increase in the number of cases. We can see the areas in Mindanao and Visayas where we were able already to determine and identify the South African and the UK variant. And dito po sa mga lugar na talagang nakitaan namin ng maraming individuals na na-detect namin yan, dyan po ngayon tumataas ang mga kaso.
So did that come from Metro Manila? I mean, from NCR? Was it a function of looser border controls? Or ano po ba ang dahilan? Or is it complacency where they were because for a long time their numbers were so low? To what do you attribute it aside from the variants? Kasi parang sabay-sabay, just when NCR Plus was healing itself, biglang nagsulputan naman yung surge sa ibang lugar. Ano po kaya nangyari dun?
Yeah, I think they got so used na NCR lagi yung nagkakaroon ng surge, ng increase in cases, and their cases, katulad nga ng sabi kanina ni Father Nick, na yung Region 5, never yan nagkaroon ng mataas talaga na kaso. Mula pa nung umpisa, pag nagmo-monitor po tayo, Region 5, very manageable lagi. Ngayon lang po talaga, kaya kahit konting taas lang, natatakot sila. And that is really something that is being felt across the different regions na tumataas ang mga kaso. Pero nakikita ho namin talaga multitude of factors. There's mobility, of course, and then there's the complacency dito sa ating pagpapatupad ng health standards natin. Katulad ng sabi ko sa inyo no isang gabi yata, ang DILG po, meron ho silang mga nahuli, di ba, yung sa violations, and for just the wearing of mask, 50,000 individuals were apprehended. For the gatherings, the mass gatherings, is about 600 plus gatherings ang na-apprehend ang mga tao. Yun naman pong physical distancing, 13,000 plus. So you can see na marami pa rin sa ating mga kababayan ang hindi nakakapag-comply ng maayos sa standards natin. Pangatlo rin po, makikita rin po natin, of course, yung porousness ng borders natin. I cannot really say na NCR nag-umpisa yan. What I can say would be, nung first detection natin para sa UK variant, for example, it started off in CAR. Yun pong unang na-detect natin na South African variant dito po sa NCR. Pero we know that the borders are porous. We know that there are incoming returning residents and OFW. So marami pong pinanggagalingan talaga. But what we can say would be that we need to go back to the basics. Hindi lang po bakuna ang makakapag-solve nitong issue natin ngayon sa pagtaas ng kaso. A lot of local governments are relying no na iniisip nila maraming bakuna, mabakunahan natin lahat, makakasolve yan. Tama naman po na dapat maprotektahan tayo lahat ng bakuna. Pero kailangan babalik pa rin tayo dun sa basic na we do the minimum health protocols and we will be protected. Remember last year, wala naman po tayong bakuna but we were able to manage. So let's go back to the basics plus the vaccines.
Ma'am, speaking of minimum health protocols, may ilan na pong nakakapuna doon sa pagbakuna ng Maynila, especially mga walk-in at mukhang nagdadagsa yung mga tao. Any update there? Have things improved in Manila from what you can see, or it's still a problematic area?
Based from what we had yesterday, no, and comparing it today, we saw that it's more organized now. So sa tingin ko naman talaga mabibigla ang local governments dahil hindi naman ho natin inaasahan na talagang dadagsain tayo ng tao na ganyan. And sa isang banda, napakabuti po niyan sa atin kasi alam natin na ang kumpiyansa sa bakuna ay naandyan. Kailangan lang po talagang maging organized tayo, mag-master list, mag-schedule so that we won't have crowding in our vaccination sites. So we're closely monitoring and from what we have seen for today, mas better po siya kaysa yesterday.
When you say po mag-master list, ibig sabihin hindi walk-in, bawal ang walk-in.
Yes, sir. Hindi naman sa bawal, no? Because meron tayo ng quick substitution list. No?
Yung pag may spoilage.
Oo, pinapayagan po natin yan. Pero kasi kapag ang guidance natin, huwag kayo magpa-walk-in kasi talagang dadagsain kayo, magka-crowd talaga. If you do master list, it's going to be organized. There will be schedules for each individual in your city.
Yusek, yung sa compliance and complacency, don't you see any problem with the messaging of government? Kasi pinapayagan yung point-to-point tourism, for example, nagluluwag ng borders. Siyempre, iniisip ng mga tao, pwede na pala kami mamasyal pwede na kaming sumama sa mga lolo-lola namin, pwede na kaming mag-swimming. Siyempre, hindi ba, isn't there inconsistency in the messaging? And you think there could be some improvement?
Yes, ma'am. There's always room for improvement naman. Pero we have to understand also that when we do these kind of things, we couple it with reminders to all of our citizens na kailangan kahit na slowly nagbubukas tayo, you should still take care of yourself and your family. And that is individual behavior na dapat gagawin natin po yan. So ito po yung safeguards natin. We're not just going to slowly open up the economy or the other industries without having some form of safeguards. Ang pinaka-safeguard po natin dyan would be the compliance to the health protocol. So kailangan magtulong-tulungan tayo, pati yung ating mga kababayan. Kung hindi, marami na pong nagugutom, marami pong walang trabaho, and it's also giving us health effects as well regarding these factors.
Okay. Health Undersecretary Maria Rosario Vergeire. Ma'am, thank you for joining us tonight at ingat po parati.
Maraming
Salamat naman, Yusek.
Thank you po. That will be all for this Thursday edition of The Chiefs. We hope what was discussed here will keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Ed Lingao.
I'm Mami Paminton of the Philippine Star.
And I'm Lucy Cruz Valdez of News 5, and we are One News.